Hello, everyone. Hello, good afternoon, good morning. Um, so the webinars that we're about to start, we are having some of the speakers are having a little bit of technical glitches, but that is being solved. We would commence in less than 2 minutes once the welcome remark speaker is online. So thank you very much for your patience.
Hello, good morning, afternoon, or evening. Thank you for joining this webinar today. We'll be starting right away and we'll be following our agenda. The first on our agenda on today's webinar is to have a welcome remark on behalf of the DG, Director General of the West African Health Organization. We have on the call Dr. Aishat Usman to give us a welcome remark on behalf of the DG. Dr. Aishat, ma.
Good morning. Good morning, good afternoon, everyone. Distinguished speakers and panelists, esteemed colleagues, partners, I bring greetings from the leadership of West African Health Organization on behalf of the Director General. You are welcome to today's session, organized in collaboration with Lassa Fever Coalition and the quadripartite partners, the Food Agriculture Organization, World Health Organization, World Organization for Animal Health, and UNEP. This webinar today, the One Health Day, and renew our collective commitments to advancing multisectoral action for Lassa fever prevention and control across West Africa. You all agree with me that Lassa fever remains a persistent public health challenge in our region. It's a complex transmission dynamic and environment. This reminds us that no single sector can address it alone. To effectively break the chain of transmission, we must continue to strengthen coordination across health, agriculture, and environment. This embodies the spirit of One Health. It collaborates and recognizes our shared responsibility for human, animal, and environmental health. WAHO
Sorry, a bit of a technical itch there. I believe network connection. We'll give her a few seconds to come back in the call.
Please, can anyone hear me?
Yes, we can, please. Dr. Aisha, go ahead. We lost you a bit, but you
Hello,
can
can
continue.
anyone hear me?
Yes, Dr. Aisha, we can hear you now, but we lost connection with you a bit.
Okay, sorry about that. So as I was saying, WAHO and the Specialized Health Institution of ECOWAS is deeply committed to supporting our member states in institutionalizing the One Health approach. Through platforms like this webinar, we aim to foster dialogue, share experiences, and develop actionable recommendations that will translate the One Health vision into measurable progress, both for Lassa and for broader epidemic preparedness across the region. I extend my sincere appreciation to all our partners and speakers for their dedication and contribution to this vital conversation. I encourage everyone here to actively engage, exchange ideas, and reflect on how we can work together to build a more resilient, coordinated, and sustainable health system for the people of West Africa. Thank you once again for joining us today. I wish us all a productive and insightful session. I thank you.
Thank you so much, Dr. Aishat, for that very elaborate opening remark, welcome remark on behalf of the Director General, West African Health Organization. Thank you so much, DG. I will now give the objectives of this very important webinar, which is projected on the screen at the moment. Today, our objectives for this webinar include to strengthen understanding of how the One Health approach can be practically applied to strengthen Lassa fever prevention and control in West Africa. The second objective, to showcase country experiences and best practices in multi-sectoral collaboration, joint surveillance, and community-based interventions. Thirdly, to identify operational and policy priorities for integrating human, animal, and environmental health systems to reduce Lassa fever transmission. Lastly, to generate actionable recommendations to guide regional and national efforts towards institutionalizing One Health within existing health security frameworks while drawing lessons applicable to preventing and controlling other zoonotic diseases in the region. So once again, we welcome everyone on today's webinar to this very important session. Thank you for joining this very important webinar. So we'll now go to the next item on our agenda for today. Dr. Aishat, please, you'll take us through the context setting for today's webinar. Over to you, Dr. Aishat.
Good afternoon, everyone. Good morning once again. So I will be going through the overview of regional Lassa fever situation and also the role the ECOWAS is playing through the Lassa fever vaccine coalition. Next slide, please. So I'll be using this outline, giving the background on Lassa across the region, some of the efforts on the vaccine development, the Lassa fever coalition, and the role of ECOWAS, and what the coalition has achieved so far. Next slide. Next slide, please. So Lassa fever is a public health threat in the ECOWAS region. We've recorded many outbreaks year in, year out, and this is placing a considerable strain on the health system in our region. We know that in the West African region, we have the high-burden countries like Nigeria, Sierra Leone, Liberia, Benin, as shown on the map on the right. And the case fatality rate for Lassa ranges between 15 to 20% in severe cases, with higher mortality during outbreaks. We also know that we have some vulnerable population among the healthcare workers, the pregnant women, and this pose increased risks, and also people from the rural communities. Next slide. So in the region, we've been recording increasing incidents and outbreaks, growing frequency in scale and also in geographical spread. We have been having cases of Lassa from countries that have not reported Lassa before. And also, we are also dealing with issue of under-reporting because most of the cases are asymptomatic. And so people just think it's ordinary fever. No, it's malaria. There are other issues with the diagnostic capacity and the surveillance system, especially in many rural areas. The true burden of Lassa that has been documented over the years ranges from 100,000 to 300,000 infections annually, with approximate 5,000 deaths. Next slide. Next slide, please. One of the key challenges that make issues with Lassa fever complex is one, the reservoir. We know this is animal reservoir, and it's impossible to eradicate the rodent host, which require the sustained environmental control. There's also the issue of population movement across borders that facilitate the spread of the virus, coupled with limited diagnostic capacity, inadequate infection prevention control leading to healthcare worker infection, and also limited stockpile for ribavirin and also personal protective equipment. We are also dealing with issues of late presentation of cases and also stigma. We have low community awareness leading to delayed care and also issues of stigmatization of Lassa survivors. Next slide. Next slide, please. So some of the efforts that have been put in place globally and also in the ECOWAS region. Globally, we have approximately 20 vaccine candidates that are currently in development. But one of the key milestones for our region is the IMV ongoing phase 2 study that started in 2024. We've also had some preclinical studies in animal demonstrating the protecting lasting up to 12 months. This phase 1 clinical trial was conducted in Liberia, showed that the vaccine is safe, well tolerated, and immunogenic. And the phase 2A trial was launched in April in Nigeria, Ghana, Liberia, targeting further evaluation of safety, immunogenicity, and dose optimization in diverse populations. And just this year, I think it was last week or so, the Oxford vaccine also launched their phase 1 clinical trial. Next slide. So coupled with all these discussions brought about the establishment of the Lassa Fever Coalition, which is a coordinated multi-partner initiative to accelerate the fight against Lassa fever. The vision is to reduce Lassa morbidity and mortality and mitigate its impacts in West Africa. And our mission is to advance a Lassa vaccine towards licensure while investing in the broader ecosystem and ensuring that vaccine can be adapted to and used by the affected countries. And for this vaccine to be that, the vaccine must be able to reduce Lassa burden, routine immunization and reactive use in an outbreak. It must be safe, effective, and of high quality. Countries must fully embrace it as a preferred choice, and also it must be deployable at an affordable cost when countries want to use it for adequate and equitable protection. Next slide, please. So the Lassa Vaccine Coalition has the governing structures that ratifies recommendation on end-to-end access Lassa program delivery. The sitting member includes four partners of the coalition, which is the West African Health Organization, the CEPI, WHO AFRO. Those are people that constitute the Lassa fever government entity. Then we have the Lassa Coalition Secretariat, which is hosted by WAHO, the West African Health Organization, which sets agenda for and also consults with countries on working group recommendations. So in countries, for countries that Lassa is endemic, we have country coalitions or country task forces, especially in Nigeria, Liberia, Sierra Leone, Guinea, and Benin were still in consultation with these countries. And for each of the countries, based on the situation, countries have working groups that looks at different issues, such as the policy issues, the technical issues, the delivery of the vaccine, and so on and so on. And some of the discussions from the countries or the recommendation also feed largely into the coalition secretariat. Next slide. So this slide is just showing the Lassa Coalition Governing Entity meeting we had in January. The chair of the Lassa Coalition Governing Entity is the Honorable Minister of Health and the Social Welfare Coordinating Minister, Honorable Mr. Pate. And you can see also the CEO of CEPI and also the Director General of West African Health Organization. And basically, this meeting is just to look at the issue, what are the progress in Lassa fever research and vaccine development, and what will be the roadmap for success for the region. Next slide, please. So what are the contributions of ECOWAS as a coordination role in strengthening multisectoral action? Regional coordination for One Health and Lassa control. The ECOWAS, through its specialized health agency, which is the West African Health Organization, provides regional leadership in coordinating member states' action against zoonotic diseases, including Lassa. WAHO work closely with Lassa Coalition, as I said earlier, is the secretariat of the coalition to harmonize policies and strengthen preparedness, also to facilitate cross-country collaboration within member states. We also mobilize multi-sectoral stakeholders, health, agriculture, environments, research to align national and regional priorities. We also promote capacity building and support laboratory system and vaccine research and development. Next slide. We collaborate also with the tripartite partners in operationalizing One Health to strengthen One Health implementation in West Africa, key technical coordination, information sharing, and policy dialogue between sectors. We also support member states through joint training, simulation exercise, and harmonized surveillance framework. We articulate common regional needs and ensure that the African perspective is central to the coalition's work. We also work with the national regulatory and policy framework to prepare the Lassa vaccine readiness and rollout. What are the achievements of the coalition so far? We have strengthened regional policy and coordination. We have a Lassa fever policy research working group that is chaired by WAHO with experts from member states, WHO, retired, and AQ and Gavi. We also have supported research on Lassa fever vaccine, including the start of the clinical trials. We've also identified some of the priority research questions on Lassa vaccine through the policy research working group. We have co-hosted a workshop for West African countries on multi-stakeholder engagement. We also organized a Lassa vaccine use case workshop, producing a draft scenario and identifying key policy research questions. Also, we have, next slide please, we have the demand forecast technical working group, who is working on looking at some of the factors, key factors that we need to consider for different member states based on available data on Lassa fever. And also one of the initiatives is what we are having now, the Lassa fever webinar series, where we look at different issues that have to do with Lassa fever research and development. We also have a bulletin we call Lassa Lens, which creates awareness on Lassa and also documents some of the researches that have been done across West Africa, especially that have to do with Lassa vaccine and development. Next slide.
4 hours, 15 minutes.
Next slide.
4 hours, 15 minutes.
So also we had in September, ECOWAS Lassa Fever International Conference that looks at strengthening regional cooperation to combat Lassa fever and emerging infectious diseases in Abidjan in September. And in this conference, we have scientific sessions, we have plenaries, we have parallel sessions and organized sessions discussing issues that have to do with cross-border collaboration on Lassa fever and other emerging infectious diseases, advancing medical cancer measures for Lassa fever. What are the technological epidemic control that we can apply to Lassa? Also issues that has to do with sustainable funding was also discussed. And in this conference, we have over 800 attendees in person, with 1,500 joining us online from 32 countries, from different ministries and organizations. Thank you. Next slide. So one of the way forward for the coalition is want the coalition to be a regional knowledge leader on vaccine readiness. We're planning to disseminate the prioritized Lassa fever research policy agenda that we have identified. We've also developed end-to-end access plan to support Lassa vaccine program, which we are hoping to be validated very soon. We're also working on developing Lassa fever research registry for the ECOWAS region, and also to continue strengthening country Lassa fever task forces in member states And lastly, working towards building a strong investment case plan for Lassa fever vaccine through partners and organizations that have commitment. So in conclusion, I'd like to say that Lassa fever is a transnational threat that no single country can defeat alone. The Lassa fever vaccine coalition provides the essential platform for collective action. ECOWAS through WAHO is the critical linchpin providing the political mandate, strategic direction, and operational coordination for a regionally owned response. Together, we can build a safer, healthier, and a more resilient West Africa. Thank you for your attention.
Thank you very much, Dr. Aishat. Please, can we give Dr. Aishat some emoji reactions? Wait a few seconds, please. Just give some reactions to that wonderful presentation by Dr. Aishat. You can use the emoji and appreciate Dr. Aishat for this wonderful and detailed presentation. Thank you so much. Yeah, thank you for the emojis. Thank you. Thank you again, Dr. Aishat. Now we will move forward using our agenda, and the next in line according to our agenda for today's webinar is the panel discussion. So I will now hand over to my colleague, Oluona, to take it over from you. Thank you.
Thank you very much, Dr. Owa, for the wonderful facilitation. I'm going to very quickly start off with the Okay, so sorry for that. There was a technical glitch. Please, can somebody confirm that you can hear me? Great. So to make sure that we don't miss any of things, because if we start to drop it on the chat box, we can very easily miss them. So please use the Q&A tab to drop your questions and your comments, contributions to the conversation. This very important conversation. For this very important conversation. And also for the chat box, I already see we are introducing ourselves. That's very great. We'll be very happy to keep the conversations on the chat box really lively. With that, I'm going to start off with introducing my very esteemed panelists to start off the discussion. So the first panelist that I'm going to be introducing is the project officer at the project officer at WAHO, project officer and technical coordinator for the health security project in West and Central Africa for WAHO, Ms. Ayodele. Please, can you unmute your mic and say hello to the participants? Can you hear me?
Good morning, good afternoon, everyone.
My internet is a little bit sloppy. Just to confirm.
Good morning, good afternoon, everyone. I hope you can hear me.
Yes, I can hear you. It's good to meet you and have you on board for this very important conversation. The next panelist that would be inviting is Dr. Mohammed Fuhad. He's representing the Interim Executive Director for the ECOWAS Regional Animal Health Center. Please kindly unmute and say hello to the participants.
Hello.
Oh, great. Thank you very much. Next, we have Ms. Dia Bori. She's the expert in One Health and gender coordination of the Multisectoral Health Security Program, the Office of the Prime Minister of Senegal. Can you hear us? Please unmute your mic and say hello to us. Dr. Dia?
Bonjour à toutes et à tous. Bonjour, est-ce que vous me recevez? Ravi d'être à ce panel.
Okay, it's very good to meet you, ma'am. So trying to sort out the technical glitches because some trying to identify her and all. But yes, that has just been sorted. Thank you very much, Miss Dia. So I'm going to, start this conversation, train the first question to very, very thankful to Dr. Aisha for setting the context of One Health, for One Health in the context of this conversation. So I'm going to start with you, Miss Ayo. Ayodele, please can you tell us in terms of your work and your project, run us through across the region, veterinary and public health systems, how they, often operate somewhat in silos, unfortunately, even though the threats exist, zoonotic threats like Lassa fever exist and is taking lives on an annual basis. I would like to hear from your experience. How can veterinary services be better integrated into national and regional disease surveillance and control systems to ensure earlier detection and response? I do know that oftentimes we have that coordination mechanism is not really the issue. It's already in place, but it's more in the administrative nature. So if you can throw more light on how it can be effective in diffusing knowledge across the sectors, it would be great. Over to you, Ms. Ayodele.
Thank you very much, and thank you for inviting me to be a part of this webinar. So veterinary services are actually part and parcel of the national and regional disease control and surveillance plans. What differs is how well this is recognized and how willing we are as nations to draw on that capacity that is inherent within the veterinary services. For example, during the COVID-19 pandemic in countries across the world, including Western Central Africa, veterinary diagnostic labs that had the right capacity were involved in the COVID diagnostic testing because they had existing capacity, they knew how to do the work, and they were brought into the COVID-19 response and asked to do that work. And so the amount of capacity that exists is huge. As we have heard clearly from the first presentation, Lassa fever is a zoonotic disease which really requires multisectoral action. And the first and most important thing is to understand that clearly and to have a clear commitment to saying that the response and the control to Lassa fever is going to be multisectoral. Once that clear decision has been taken, the key things in terms of institutional and administrative arrangements are that, again, there needs to be a commitment to open communication and sharing amongst technical officers. And that needs to be backed by the requisite authority. because technical officers who are willing to share information and to act together with their counterparts within the ministries of health, within our national public health institutes, within our ministries of environment, need the requisite permission as per the civil service rules to share such information. And so it really all boils down to commitment. What commitment do we have from our authorities in the different sectors that we are going to work together? And have we backed that commitment with the necessary authority so that people know that they are supposed to share and know that they are able to share openly? And in terms of doing this, it's really quite simple. The core of One Health is cooperation, is collaboration, is communication. So it's also really, really important to create as many opportunities as possible for the relevant people to get to know each other and to build those relationships. Because you are far more likely to communicate and collaborate with people that you know. I will close this answer by also saying that institutions, whether at national or regional level, including institutions like the World Organization for Animal Health and the Health Security Project, have a big role to play in this in terms of providing opportunities during regional events for colleagues from different sectors and different countries to meet each other, to hold dialogues, and to build those working relationships that will enable sharing of information and joint response to deadly zoonotic diseases such as Lassa fever. Thank you.
Thank you very much, Ms. Ayo. That's very spot on in terms of adding to the context that we do need as we progress in this discussion. I'm going to come back to you with some questions that you had mentioned, especially as it borders around capacity and building on capacity for One Health. But before I would still come back to you, ma'am. I would just proceed to Dr. Fuhad. Dr. Fuhad, are you there? The question I'm going to be throwing at you, we do know that the regional animal health systems, they do play a very important role in supporting the ECOWAS member states to implement One Health. But realistically and practically, could you please share with us some of how the center is working to operationalize One Health, either in regional coordination, strengthening early warning signs, and all of that in practice, and not merely the administrative part of it. Over to you, sir.
Thank you very much. I hope you can hear me.
Loud and clear, sir.
All right. In terms of operationalizing One Health, to actively operationalize One Health, the center has fostered multi-collaboration between animal, human, and environmental health sectors across our member states. We work closely with our partners, including WAHO, to strengthen regional capacities in policy formation, in disease surveillance, and rapid response interventions, specifically targeting zoonosis, like the Lassa fever we are talking about. And key achievement we have in fostering this collaboration include the establishment of the regional One Health coordination mechanism, as well as the establishment of the prioritized zoonotic disease. ECOWAS was the first region to use the One Health zoonotic disease prioritization process to prioritize 7 diseases of concern to the region. With this identified priority zoonotic disease for the region, our member states can collaborate more effectively to address zoonotic disease threats across the region using the One Health approach. Also strengthening national and regional level multisectoral sectors will also strengthen regional coordination in terms of operationalizing One Health approach. Then there are also some collaboration we had with, for example, the West African Health Organization in terms of projects such as the One Health West African project, the REDESI project. This involves strengthening early warning systems for zoonotic diseases by integrating data from both the animal and human sector and promoting timely information sharing. It also involves establishing and enhancing regional networks of laboratories and surveillance. We have established the RESOLAB, which is a regional network for laboratories, as well as the RECIPE, which is the regional epidemiological surveillance network for the region in terms of animal health, and we do meet annually. So these are some of the approaches we have. There is also instances where there is a coordinated joint field investigation and rapid response teams mobilized across sector activities to control and mitigate outbreaks. We are also supporting multisectoral environmental health and rodent control intervention, which is critical, for example, in diseases like Lassa fever, so through collaboration with national ministries and our partners. Also, is facilitating of regional data sharing platform and information system for epidemic preparedness and cross-border collaboration. We have established what we call the Regional Animal Health Information System. WAHO is still helping us to provide a space in terms of operationalizing fully that system. And lastly, I will also cite the recent Regional One Health Strategy and Governance Manual, 2025 to 2029, which also is a work in process for fully operationalizing it. This all will go a long way in helping to operationalize the One Health approach in our regions. Over.
Thank you very much, sir, for that. It's good to hear that we do have a regional One Health manual, in addition to other systems that have been put in place. One thing that would be very interesting to know is how the regional animal health systems, works together with the public health systems to make sure that we are not working in silos, but working in unison in developing, for example, the health information system, for example. That would be a good, something to hear more on, but I would come back to you on that. I'm going to hand over to Mrs. Boridia right now. We've heard from WAHO in terms of how they structured support in the region and also capitalize on existing capacities and all of that, especially with the COVID and all that. We've also heard from the regional animal health system. It would be good to hear from one of the countries at least, and great to have a representative from Senegal here. Senegal often comes up as one of the regional examples for embedding One Health within the national governance structures. Can you perhaps walk us through how Senegal has mobilized diverse ministries, agencies, and all the diverse actors in play to coordinate the intersections of human, animal, and environmental factors. So I'm going to hand over to you now. It'd be good to also highlight some of the lessons that other countries or other member states can learn from Senegal. Over to you, ma'am.
Merci beaucoup. Merci encore une fois de plus pour cette invitation pour venir partager des modèles. Je pense que l'une des forces du Sénégal a été de faire de l'approche une seule santé un levier de gouvernance nationale et pas seulement un projet technique. Dès le départ, nous avons voulu que cette approche soit institutionnalisée au plus haut niveau, sous la coordination donc, directe du Premier ministre. Donc, c'est ainsi qu'a été créé le Haut Conseil national de sécurité sanitaire One Health, donc, comme je l'ai dit, présidé par le Premier ministre, qui aujourd'hui réunit tous les ministères concernés, la santé, l'élevage, l'environnement, l'agriculture et d'autres ministères comme celui de la famille et des solidarités, de l'intérieur, des collectivités territoriales, donc vraiment d'autres ministères qui sont aujourd'hui considérés comme des ministères d'appui à la mise en œuvre de l'approche One Health. Par exemple, lors de la flambée de la fièvre, donc nous vivons la fièvre de la vallée du Rift actuellement, donc qui est survenue depuis septembre 2025, il a été activé le COUS, le COS, le Centre d'opération d'urgence sanitaire, et a été mis en place un système de gestion d'incidents, vraiment pour coordonner les secteurs de la santé humaine, animale et environnementale, ainsi que les autres secteurs d'appui. Mais également, il faut noter qu'aujourd'hui, les laboratoires, donc l'Institut Pasteur, le LENERV, l'IRSF, qui sont des laboratoires, vraiment, on travaille ensemble pour la confirmation des cas et la surveillance intégrée. Il y a également, nous pouvons noter des réunions interministérielles qui permettent aujourd'hui d'harmoniser les décisions pendant que les comités régionaux également, parce qu'au niveau décentralisé, nous avons les comités régionaux One Health autour des gouverneurs, coordonnent également les activités sur le terrain, surtout à Saint-Louis, la région de Saint-Louis qui a été affectée par la FVR, Louga également et Matam. Donc, c'est des régions qui aujourd'hui sont affectées par la fièvre de la vallée du Rift. Ce qu'il faut également saluer aujourd'hui, c'est que la riposte n'a pas été intersectorielle, mais plutôt intégrée. Et par exemple, pendant que les services de santé aujourd'hui prennent en charge les cas humains, les équipes vétérinaires également vaccinent le bétail. Et les services de l'environnement également aident à traiter les mares d'eau, et les foyers de moustiques par des activités de saupoudrage. Cela également illustre concrètement ce que veut dire travailler ensemble pour une seule santé. Donc, il ne s'agit pas seulement de collaborer. C'est vrai, collaborer, c'est bien, mais il faut coordonner les efforts avec une synergie d'intervention pour qu'on puisse parler aujourd'hui de l'opérationnalisation de l'approche One Health, parce que le One Health n'est qu'une approche qui nous permet de travailler ensemble. Donc, la même synergie a été observée également lors de la riposte au Mpox, où les secteurs de la santé, de l'élevage, de la communication et de la recherche ont collaboré pour renforcer la surveillance, adapter les messages de prévention et vraiment réduire la stigmatisation. Les leçons qu'on peut en tirer aujourd'hui, c'est le leadership, le leadership politique au plus haut niveau. C'est vraiment important parce que cela permet de fédérer l'ensemble des secteurs. tous les secteurs se sentent aujourd'hui concernés par l'approche One Health. Parce que c'est au niveau, donc c'est un leadership élevé. Quand la primature donc, porte la coordination, tous les ministères vraiment répondent surtout à l'invitation. Ensuite, il est aussi essentiel de décentraliser la gouvernance. Les régions doivent pouvoir décider et agir vite. C'est pourquoi nous avons renforcé vraiment la capacité des gouverneurs autour des CRD, les comités régionaux One Health, pour que eux aussi qu'ils puissent disposer des outils nécessaires pour leur permettre de prendre les décisions eux-mêmes et d'agir eux-mêmes et très rapidement, parce qu'en cas de réponse, il faudra prendre des décisions éclairées très rapidement. Cependant, tout cela n'est pas sans défi. Aujourd'hui, il faut une pérennisation de ces dispositifs multisectoriels. Il faut qu'ils continuent à fonctionner même en dehors des périodes de crise. Il faut aujourd'hui qu'il y ait le partage de données entre ministères, doit être encore renforcé. Il y a un niveau de partage, mais il n'y a pas encore cette interopérabilité. Donc, il faut qu'on ait des outils communs et vraiment des protocoles clairs. Vraiment, pour résumer, on va retenir que le modèle du Sénégal fonctionne parce qu'il repose à la fois sur une volonté politique forte, mais également un partenariat intersectoriel solide. Aujourd'hui, les groupes techniques de travail fonctionnent. Nous avons donc 16 groupes techniques de travail qui aujourd'hui fonctionnent et offrent des cadres d'expertise avec différents profils pour que les gens puissent travailler ensemble, partager leur savoir et co-construire des stratégies. Voilà un peu le modèle du Sénégal au niveau national, mais également au niveau le plus proche des populations avec les plateformes d'engagement communautaire également. Merci beaucoup.
Thank you very much, Dr. Bori. Very spot on. One thing that resonates with us, or something that we need to resound, is what she said about collaboration is good, but coordination of these different pieces is even more important. And also, for coordination, that's where the political will, the leadership comes in. It's very exciting what Senegal is doing and saying that it's possible for all member states to do this because Senegal is doing it. Thank you very much, Ma. Before I go to the next question that I have for Dr. Fuhad, I'm going to come back to you now. But I would first reiterate to the participants that there is interpretation or translation for you. I noticed that some people are unable to, change to be able to listen to French and listen to English. So all you need to do is to find the interpretation tab, click on it and select the language. And that way you'll be able to listen to both ends of the conversation. Thank you very much. All right. Now, I'll come back to you, Dr. Fuhad, and it's mostly around some of the things that Dr. Bori has mentioned, and also, what she mentioned about sustainability, but more than that, the issue that they are facing in sustainability, more than that, also interoperability of tools across the different sectors, not just the animal health system, but also public health systems, environmental health system, and all those. So it'd be good for us to hear from you first of all, if there are, those mechanisms to make sure that everybody is not just working in their different pieces, but working together to achieve the goal, that's where coordination comes in. And then I would like to answer that first, the full-on question I already noted. Over to you, Dr. Fuhad.
Yes, thank you very much. With regards to coordination on the animal health sector, I hope you can hear me. Am I audible?
Loud and clear, sir.
All right. With regard to regional coordination on the animal health sector, I think we have a coordinated mechanism that has been in place. We have the two networks, the recipe, which is the surveillance network, regional level. We have the Resolab, which is regional level, and we have the regional veterinary committee. So we have 3 networks that we coordinate at the regional level, which meets at least twice in a year, where they will discuss and agree on issues related to animal health. So that is the one of the mechanisms we bring them together to be able to synergize whatever they are doing, so that they will have a positive result in the various programs that they do, instead of working in silos. Over.
Yes, it's very good to hear that you have existing networks to ensure this coordination. So I'll get to the next question that I had for you, sir, and it's around, financing. When we are talking about making things work, we need to talk about money at some point. So many animal health interventions sort of rely heavily on donor funding and, are mostly project-based. And also, what strategies can help member states to institutionalize and sustain, these interventions that the regional animal health center is supporting them to institutionalize. Over to you, sir.
Thank you very much. This is a really sensitive issue you have touched. We all know what is happening in the world now. A lot of funds have been cut. In fact, they are very limited. For you to get fund is something that you have to change your mindset. And for us, we have started encouraging our member states to shift from project-based funding to an institutional funding by integration of animal health intervention into their national policies and budget to secure domestic funding and political commitment. This is critical. There is no other way than to go into that. There are most of our member states that have committed at continental level and even global level to secure certain percentage of their budgets towards animal health issues. Those commitments are there. So it's now a reality for them to actually revert back to that commitment and be able to integrate animal health intervention into their national policies and budget to secure domestic funding, and as well as have the political commitment. Also, they need to strengthen governance frameworks and multisectoral coordination mechanism, both at national and regional levels, to harmonize effort and to also ensure ownership. There is need for them to build the capacity building of their laboratories, their surveillance network, and veterinary services in a whole, with a government system to maintain diagnostic and surveillance function independently, because you need to separate the two. Then there is need also for development of regional guidelines. For us, we have started developing those guidelines, standard operating procedures, and also harmonized protocol for both surveillance and vaccination campaign. FAO have assisted us a lot we have collaborated with FAO in issue of guidelines, standard operating procedures, and harmonized protocol for surveillance and vaccination campaigns to facilitate consistency and sustainability. We need also to, they are also encouraged to, for example, leverage on regional partnership to pool resources rather than waiting for fund coming from somewhere else. In that regard, we have been able to recently pass a regulation on the ECOWAS Emergency Fund, which is supposed to be lodged in IBID. IBID is the ECOWAS Bank for Development, International Development, based in Lome, Togo. So this also need to be fully operationalized. There is need for promotion of public-private partnership and engaging local communities to support our animal health activities. So I will stop here. I don't know if I'm able to dwell in with the answers is satisfactory or not. Thank you.
Thank you very much. You did justice to the question. Thank you for highlighting all the things that are being put in place to ensure that the work goes from project-based to more institutional, to be more institutionalized. Great to hear that FAO supports you in this work that you do. And we have FAO on the call. He was supposed to take the opening remark, but there was like a bit of technical glitch. He's going to sort of round off the conversation and give his remark in that regard. And it's also great to hear about the ECOWAS Emergency Fund. It will be very helpful to be able to institutionalize One Health approaches knee-deep into the countries. Thank you very much, sir, for that. And I'm going to come back to you, Ayo. And I'm going to first, it'd be good for you to, shed more light in terms of how you build capacity, if there are strategies to build the capacity. Because when you were speaking earlier, you mentioned that you leverage existing capacity when COVID hit. It'd be good to hear if there are structures in place to help to build this capacity ahead of any threats or outbreaks that might be lurking around. But then the major question I was going to ask is no longer news that zoonotic pathogens, they do not respect borders, and it does not also mind if there are weak information flow or things like that. It does not also mind if the coordinated response is low and all. So bearing in mind that the outbreaks can happen at any point, can you perhaps share with us some practical, mechanisms or innovations that can strengthen timely cross-border collaboration and coordination? Taking this based on what Senegal had mentioned. So cross-border collaboration and coordination between the veterinary and human health systems in the ECOWAS member states. Over to you.
Thank you very much for this question, which is quite an important one when it comes to regional coordination for zoonotic diseases. So in terms of capacity building, the World Organization for Animal Health does a lot through its regional representation for Africa. First of all, we tend to work with countries to understand their current level of capacity through the PVS assessment, which is a national assessment in terms of the strength of the veterinary services, which helps us to identify gaps and to then make plans working together with the country authorities to see how capacity can be built, whether this is through training, whether this is through laboratory twinning of national laboratories with our regional and global reference laboratories, whether this is through experience sharing and regional activities that bring together different countries within a region to learn from each other, to share experiences, and that way to strengthen the entire region, but also to work towards harmonization of standards, and also, very importantly, to ensure that you have equitable levels of capacity across different countries. This is really important because, for example, if you have an outbreak of Lassa fever, which spans 2 different countries, and you expect both of them to respond, it would be great if the capacity of the surveillance systems across the 2 countries, the capacity of their veterinary response, the capacity of their One Health and multisectoral collaboration is equal, and that they are using similar, if not identical, guidelines for cross-border cooperation. And this is where the work of organizations like WAHO really, really comes in at the regional level. Of course, working hand in hand with the West African Health Organization, WAHO, and the Regional Animal Health Center, both under ECOWAS. In terms of how to practically strengthen joint response, I mentioned earlier the importance of open and timely information sharing backed by the requisite authorities. But it's also really important to ensure that we have common guidelines in terms of diagnosis, in terms of notification. Again, WAHO is the international body at which all notifiable diseases should be reported by national authorities. But in terms of making sure that that notification is timely, it's really important within countries to ensure that veterinary services have the requisite capacity such that information that comes from a field veterinary officer at the community level or at the local level, that information travels to the national level quickly and efficiently, such that from that level it can be shared with WAHO, but also with the ECOWAS Regional Animal Health Center, as well as with the veterinary and public health authorities in neighboring countries. So in terms of joint response, we keep coming back to the key principles of One Health, which are communication, collaboration, and coordination. And as we've heard from Madame Bori in Senegal, coordination is really important. Within each country, does every officer at the Ministry of Health, at the veterinary services, at the Ministry of Environment, do they know what they need to do in case of an outbreak? Do they know what they need to do in peacetime? Do they know what they need to do in an emergency? Do they know who they need to communicate in the counterparts ministries? This is really important to ensure that we have within the national One Health mechanism structures to ensure that everyone does what they do and that information flows, but also at the regional level that this also works. And the WAHO animal health bulletins that come out on a weekly basis are a big way, are an important avenue to ensure that official notification of these transboundary diseases, whether in humans or animals or they're zoonotic, happens seamlessly. When it comes to innovative mechanisms like simulations for disease response or emergency response, it's important to have these at national level to ensure that that coordination between the One Health entities within the country takes place. But it's also important to ensure that this also happens across the region from country to country. So WAHO does help at regional level, working together with the entities at ECOWAS that I mentioned, to organize, to provide both technical and financial support to organize these kinds of joint simulation activities, to have joint training and experience sharing activities. And importantly, through the health security projects, which is currently taking place across West and Central Africa, WAHO is supporting capacity, not just within the veterinary services, but importantly, capacity to improve the level of coordination and collaboration across sectors, and to improve the capacity of the veterinary services to work hand in hand with other sectors. One, to strengthen our One Health systems during peacetime, so that we are able to effectively detect and prevent emergencies, but also during outbreaks and emergencies, to ensure that that capacity for collaboration across sectors is there to effectively respond using the One Health approach. Thank you.
Thank you very much, Ms. Ayo. Very elaborate answers that you've given. I particularly love the different mechanisms that you use for capacity building, especially during the peace times. You mentioned the trainings, the lab twinning, and the rest of that, even experience sharing, and of course the joint simulation. It's great to hear that some of these things are already being put into play. And if there was more time, I would have perhaps asked you, knowing that some of these things, a lot of people don't know, a lot of, based on some strategies that I've had the privilege of looking through across the region, there's still gap in terms of being flexible around knowing what they should be doing at peacetime. But yeah, we are already almost short for time, so I'm going to just go straight to Dr. Bori with my last question, and that would before I get to that, I would just encourage us to drop our questions on the chat box, the Q&A session, and then we will get to it after the panel discussion. So Dr. Bori, experience really has shown that effective zoonotic disease prevention depends not just on the technical system, but also on inclusive engagement. And you've done justice to, explaining that when you spoke first. So it'd be good to hear more on how Senegal approaches community inclusion. It's one thing to include all these different sectors and ministries that are having ministerial debriefing, like you've mentioned, and all those intersectorial or interministerial meetings and all. But how do you include the community in One Health implementation? And also, if possible, if you can throw more light, how do you ensure gender inclusivity in One Health implementation? How can these, social dimensions enhance ownership and sustainability of interventions for diseases like Rift Valley fever, for example, that Senegal is managing at the moment? Over to you, Ma.
Merci beaucoup, Madame la modératrice, pour cette deuxième question qui est essentielle, je dirais. Je vais partir de la situation que nous vivons actuellement au Sénégal. Parce qu'au-delà de la coordination, comme vous l'avez souligné, technique ou bien institutionnelle, le véritable succès de l'approche One Health ou bien une seule santé se joue dans les communautés. Vous l'avez bien mentionné. Au Sénégal, nous avons appris que sans la confiance des populations, aucune stratégie, même la mieux conçue, ne peut réussir. C'est pourquoi nous avons fait de la CREC, un pilier vraiment central de notre dispositif. Donc, la CREC, c'est la communication des risques et engagement communautaire. Donc, actuellement, lors de la flambée de la fièvre de la vallée du Rift, nous avons mené une mobilisation communautaire massive. Aujourd'hui, plus de 2700 éleveurs ont été sensibilisés directement, notamment dans les régions de Saint-Louis et Matam. Des radios communautaires également ont diffusé des messages de prévention en langue locale, parce que c'est important de prendre en compte cette dimension locale. Des relais communautaires également ont organisé des visites de proximité dans les villages et sur les marchés à bétail. Également, les femmes éleveurs et transformatrices de lait ont été mobilisées comme relais clés parce qu'elles sont au cœur de la production animale et de la sécurité alimentaire. Donc, les femmes aujourd'hui constituent vraiment des acteurs clés de changement. Donc, c'est pourquoi nous les avons bien impliquées dans ce processus-là. Cette approche inclusive vraiment a permis de réduire, on va dire, les comportements à risque, de renforcer également la vigilance sur les signes de la maladie animale et surtout de créer aujourd'hui un sentiment d'appropriation locale de la réponse. Avec Mpox, je vais dire que nous avons également fait face à un défi différent, c'est la peur. Avec Mpox, nous avons vu la peur, la stigmatisation et un peu la désinformation. Là encore, la solution a été sociale avant d'être technique. Nous avons travaillé main dans la main avec les leaders religieux, les organisations de jeunes et de femmes, les médias également communautaires pour vraiment diffuser des messages non stigmatisants afin de lutter contre les rumeurs et encourager aussi la recherche de soins. Donc, vraiment, ces actions ont été menées et cela nous a permis aujourd'hui de restaurer la confiance, de mieux orienter les cas suspects et de renforcer la solidarité communautaire. Donc, il y a eu ces actions autour du Mpox. En termes de bonnes pratiques, retenons qu'il faut aujourd'hui impliquer les communautés dès la planification et pas seulement au moment de la crise. C'est pourquoi nous avons mis en place ces cadres. Ces cadres permettent aujourd'hui d'identifier tous les acteurs importants concernés par la situation qui prévaut et de les mettre ensemble pour qu'ils puissent ensemble co-construire des stratégies. Donc, aussi de valoriser le rôle des femmes et des jeunes qui sont souvent les premiers relais d'alerte. Les femmes, il faut toujours les aider parce que en période de crise, ce sont les premiers impactés. Utiliser également donc des canaux de communication locaux et des messages adaptés au contexte culturel. Récemment, nous avons fait une formation, un renforcement de capacité avec tous les pays membres de la CEDEAO pour vraiment qu'on puisse aujourd'hui, dans la définition de nos messages aux populations, d'adapter le contexte local et social avec des messages ciblés, en segmentant les cibles. Donc, ceci me paraît extrêmement important parce qu'il faut parler aux cibles. Les messages qui parlent à tout le monde peuvent ne pas engager tout le monde. C'est pourquoi il faut cette segmentation des cibles afin de produire des messages adaptés par rapport également aux canaux de diffusion et aux horaires. Même, il faut même les adapter par rapport aux horaires d'écoute. Donc, tout ça, c'est très important de prendre cela en compte. Et aussi, aujourd'hui, il faut faire du dialogue social un outil permanent, pas une action ponctuelle. Aussi, nous faisons face à d'autres défis, c'est de renforcer les capacités locales en communication des risques et en veille sociale, mais aussi veiller à ce que la dimension genre, comme vous l'avez dit, soit pleinement intégrée. Elle est intégrée, mais elle n'est pas effective. Donc, il faut qu'on note que les femmes sont au cœur de la santé animale et familiale, mais aussi, donc, elles restent souvent sous-représentées dans les instances décisionnelles. Il faut encourager aujourd'hui donc la participation des femmes aux instances de décision. En définitive, les expériences du Sénégal, aussi bien sur la vallée du Rift et sur le Mpox, montrent que la réussite d'une approche une seule santé repose sur 3 piliers complémentaires: une coordination politique et technique forte entre les secteurs, une participation communautaire réelle et inclusive, et une gestion durable de la confiance basée sur la transparence et l'équité. Donc, ces piliers, aujourd'hui, s'ils sont renforcés, peuvent servir de base solide à la prévention et au contrôle de la fièvre, donc en général de Lassa et d'autres même zoonoses dans la sous-région. Merci beaucoup.
Thank you very much, Dr. Bori. Very important points you've highlighted there. Very good to hear the 3 points that guide the Rift Valley management as of now. And good to hear that community engagement is prioritized, and that also is in sync with what is happening with the Enable study, which is the largest Lassa research that is going on in the region. We're also prioritizing community engagement to build trust ahead of even with the clinical trials and all. So thank you very much. I see a couple of questions that are all directed to Miss Ayo. So I will just, read them out and then let her answer very briefly. We are also, the time is also not our friend. I say, okay, that she has dropped the answer, but it'd be good for people on the Q&A session, but it'd be good for people to also be able to hear from you on these 2 questions. The first one I'm going to be asking is what WAHO has in place to support and collab and for support and to collaborate to institute One Health institutes for the Usman Danfodio University and One Health students. I see you already dropped that, but it'd be good for you to, answer to that for the benefit of other people. There's also Lassa fever being asymptomatic and all, but the question is around if there's a collaboration between health security projects and security agencies across the ECOWAS region in the area of disease preparedness, coordination, response, knowing fully well that the disease can ignite instability and social unrest. So these are the 2 questions that I'm going to be prioritizing for now for you to answer before we begin to round up. Over to you.
Thank you so much. For the first question, WAHO recognizes the importance of youth engagement as well as participation of youth in driving the One Health approach. And we do have some youth engagement initiatives, such as the conference last year looking at youth perspectives on the veterinary workforce in Africa, because, the future of the workforce is the youth. We also do quite a bit of youth engagement through our membership of the quadripartite in partnership with FAO, WHO, and UNEP. For example, the quadripartite working group on youth engagement for antimicrobial resistance. So I would urge you to explore our youth engagement opportunities and to get involved as and where you can. Thank you. For the second question, WAHO as a global organization tends to work directly by supporting the veterinary services of the various countries to strengthen their capacity, not only to fulfill their functions in animal health, but to improve their capacity in terms of meeting global standards, as well as the capacity to communicate, to collaborate, and to work together with other One Health organizations within their countries, within their continents, and at a global scale. And so in many countries, as we've heard a little bit from Madame Bori in Senegal, you have the security services as an important member of the One Health mechanisms at national level. And it is at this level that through the capacity building and support that WAHO is able to provide, that public health, animal health, and other One Health entities work hand in hand with their national security services to ensure that during outbreaks, law and order are maintained. And of course, we as health professionals, as animal health professionals, there are regulations and policies that underpin the work that we do. And we rely on the security services in our various nations to help us to enforce these. So this is really mostly an issue that happens at national level. However, in terms of ensuring that law and order reign during outbreaks, risk communication and community engagement are very, very important in terms of ensuring that people have the correct information as to what is happening. That people know what they can do to prevent or avoid infection, and that people know where they are able to report cases, whether suspected cases of disease to the authorities, so that the appropriate action can be taken. When people are well informed, when people have a clear understanding of the level of risk, and of the consequences of doing the right thing, which has been recommended, versus doing the opposite, you find that you rarely have incidences of civil unrest linked to disease outbreaks. And so this is how WAHO is able to support national veterinary services to improve risk communication and community engagement during peacetime before outbreaks occur, to ensure that as and when an outbreak or emergency occurs, we don't have this spilling out into unrest. In the same way, at regional level, the regional economic blocs such as ECOWAS have the health and veterinary teams who also work with the security teams at that level. But WAHO does not have any direct engagement, so to speak, beyond improving the capacity for multisectoral collaboration. Thank you.
Thank you very much for that very comprehensive response. I'm aware of the time. We're already 1 minute after 12:30 GMT. So bearing that in mind, please permit me to proceed and to not take some of the questions. With your permission, I would go on to call Dr. Serge. I'm sorry if I pronounced that wrongly, to round up the conversations that we've had and give his remark in terms of what FAO does, with a focus on strengthening the collaboration when it comes to agriculture and livestock sectors for One Health. Over to you, sir.
Thank you. Can you hear me?
Loud and clear.
Now, first and foremost, thank you for inviting me, and congratulations for this important webinar on strengthening multisectoral action for Lassa fever prevention and control in West Africa. We know that regarding that regions, Lassa fever remained a major public health, affecting thousands of people every year and threatening livelihoods, food systems, and economy. Clearly, it's a disease that starts and reminding us why One Health is important. As for FAO, the organization I am working for, is committed to strengthening the contribution of livestock sector to One Health. Most importantly, to help countries to build robust and resilient systems that can prevent, detect, and respond to health threats of known and unknown disease origin before that escalate, to into a crisis. Having said that, what came out from this panel discussion, few keywords are, let's say, sustainability. And this is an opportunity for me to share with you that as a pandemic fund coordinator at WAHO, the portfolio is 44 countries. The sustainability question is at the center of these supports. And to address this sustainability question, first, there's this co-financing, co-investment, which is embedded in the proposal design to make sure that country will mobilize domestic resources, which will be used within the project if the proposal is successful to leverage on what has been mobilized in terms of co-financing or co-investment. At the same time, to leverage to trigger a new fund. That is the financial aspect. And the sustainability is also linked to how to strengthen organizational and institutional capacity. Yes, one of the panelists said resources are scarce, right? The fact is sometimes, you can have that resources, but if you don't have strong institutional capacity or organizational capacity, it's quite challenging to deliver, on your missions. Another point here is about, I heard about engaging community, and I think the panelists from Senegal talked about, engaging community. So risk communication and community engagement is also central as part of a pandemic fund project because that is linked to ensuring safe and sustainable food system by protecting consumer, and support a livelihood. The fact it's more than at least 18 countries across the portfolio, have activities related to that. We talk about those guidelines, SOPs, harmonizing them, across the countries, which is also linked to one of the key areas supported by the pandemic fund. It's about promoting sound environmental management to address the ecological, drivers of diseases such as Lassa fever. And again, with the support of pandemic fund, there's activities on the wildlife surveillance, which is a very important one to enhance veterinary services in their mission to deliver animal health services, not only at the national level, but to make sure that through a decentralized, activities working with other sectors, wildlife, for instance, that upstream work will be done properly. There's also a work on advancing biosecurity, improving through the livestock value chain and minimizing the threat. That's why, for instance, if that can be done also by improving collaboration, coordination in terms of information sharing, that's where there was a lot of emphasis on One Health. I think colleagues from Senegal and from who are as well, mentioned that the question of trust, if there's no trust, implementing One Health at the community level will be challenging. So I will not speak longer than that. I know the question of interoperability, it's, has been raised here. most of the time we are only focusing on tools, but in addition to that, if you don't have a legal framework, high level coordination, as it has been mentioned, it will be quite difficult. So the Pandemic Fund provide a unique opportunity here to strengthen collaboration, across ministry sectors and partners. So again, thank you for inviting me for this webinar. I really hope that for all the participants, it has been, useful because together we can make a progress toward reducing risk of Lassa fever and other zoonotic threats, and ultimately contribute to healthy, safer West Africa. Thank you very much. I wish you all a very end of the day. Thank you.
Thank you very much, sir, for that. You have touched on a lot of the pieces that we have discussed over the last couple of minutes. So I'm going to hand over to the facilitator, Dr. Uwa, as the survey link comes up with our learning organization. We hope that you'll be able to scan it and give us feedback on the webinar for us to improve. Over to you, Dr. Uwa.
Yes, thank you so much, Solomon, for coordinating that section. It was really impactful and enlightening. And I guess participants on the call in this webinar must have grasped a lot of information and knowledge. Thank you so much, Solomon, and the panelists who were on the call. Thank you so much for the panelists. Thank you. So currently projected is the QR code. Please kindly click the link. It's also in the chat box. You can click the link and give us your feedback. We'll give some few minutes for that as we wrap up. Also, Dr. Sage, you can kind of look at the Q&A section. There is a question directed to you. If you could please just type it, the response in the chat box. Sorry, in the Q&A section. Thank you. Thank you so much, Dr. Sage, for your response. While it's doing that, please let's kindly fill in our feedback using the link in the chat box. So a few seconds left for this webinar. We really want to appreciate every panelist as well as participants who took out time to join this webinar. Thank you so much for the sacrifice of your time. Thank you, Dr. Sage, for your response. Please look at the response on the chat box. And we want to wish everyone to enjoy the rest of their day, their nights, depending on where you are joining us from. Thank you again for your attention. Bye.